guys, so today what I'm going to do is I'm going to go ahead and I'm going to be administrating IM injection with Z-Track. So before I get started, I'm going to go ahead and perform hand hygiene. And then I'm going to verify my order for the medication, what type of medication I'm going to be giving for IM. And then later on, I'm going to verify pertinent data, which is physical examination of the patient that I'm administrating to, and the vital signs of the patient, and then their lab values, to make sure there's not any abnormalities that will be affecting with the medication that I will be administering to the patient. After that, I'm going to go ahead and be with my instructor. So I'm going to explain to my instructor the type of medication that I'm administrating, the adverse effects, and then the assessment criteria and the teaching that I'm going to be giving to the patient. So after I'm done with that, I'm going to go ahead and gather all my supplies. So I'm going to get a needle. So for IM injections, you're going to have the gauges is typically more bigger than compared to a sub-Q. So this is a 22 gauge right here. So typically for IM injections, it's 20 to 25 gauge. And then the needle size is also larger. So it's gonna be a 1 and a 1.5 needle size. Okay. So I'm gonna get my needle and then I'm gonna get my medication. So here on my sheet, it says right here that the medication that you will administer is available from the doctor's orders is 125 mcg to 5 milligrams. Okay. So and then the order for the medication from this vial is gonna be 50 mcg. So if I do the calculations, it's gonna come to 2 ml. So the most I could do on deltoid is 1 ml. So I would have to choose another site rather than deltoid to administer the medication. So I'm gonna go ahead and with the vastus lateralis for IM. So after that, I'm gonna go ahead and perform hand hygiene again. I'm gonna go ahead and put on my gloves. And then I'm gonna go ahead to my patient. I'm gonna introduce myself, and then I'm gonna have 2 patient identifiers, which is their first and last name and their date of birth, and then I'm gonna double check on the wristband. Okay. I'm gonna get my medication ready. Open this up. Clean this up. I'm gonna pretend this is my vial. Okay. I'm gonna get 2 mLs. So this is 2 mLs right here. 2 mLs because this is an ml. So I'm gonna do the air first. Okay, I'm gonna take this off. Okay, I'm gonna put my air. Okay. So there's air. I have to put it, and there's still air. So this is kind of hard. Well, the vial's already been used a lot, so it's gonna be dripping a lot. Okay. And then there's air bubbles, kind of like whack it, which I have one tiny one right here. Okay. All right. Put it down. Okay. Take it out, and then go like this. Scoop. Scoop. So for this one, I don't have to go with another nurse to identify. It's gonna be 2 mLs right there. And I have a bubble, but it's leaking. Okay. So I'm gonna go to my patient. I'm gonna tell them what I'm giving. just to make sure they're okay with it. If they refuse, then I will document refusal of medication. Tell them what I'm giving and what it is. And then I'm going to go to the injection site. I'm going to go ahead and clean. And since this is Z-track, what I'm going to do is I'm going to pull the skin back with this arm. I'm going to go like this. So I'm going to take this off. I'm going to like stretch the skin with this hand. As I'm stretching, I like give. So this one's going to be at a 90 degree angle. Like as I'm stretching, I go ahead and automatically give. Like I stretch and I give. So this kind of has to be kind of quick. And then when I let go from this hand, I have to let this go. And then safety. And then gauze up if they're bleeding or not. So once I'm done, go ahead and get all my supplies, put this in the biohazard, clean up, and that's it. And then document that the time and then the date, and then I guess the area of where I performed the medication, and then I guess my name, so they know like everything was documented and it's in the system. And that's it.